Welcome to Pharmative Live. I'm Dr. James Partyka. I'm your host. I'm a clinical pharmacist. I'm an oncology research scientist, and I'm the founder of Pharmative. Pharmative is all about connecting people and patients to healthcare professionals and scientists in order that we can educate ourselves about important healthcare matters, health, and fitness. That's Pharmative, and this is Pharmative Live coming to you from Palm Springs, California. Today we're going to be talking about what you need to know about taking an at-home COVID-19 rapid antigen test. But before we begin, I just want to thank our sponsors from our sister company, Pride Nation Radio. Pride Nation Radio is the #1 LGBTQ music station in the nation. And not only is it great music to dance to, but it's also great music to work out to as well because of its fast beat music, uplifting music, and that's Pride Nation Radio. And you can get Pride Nation Radio either by asking Alexa to play Pride Nation Radio or by entering pnn.fm or pnn.1 into your web browser. You can also download our pnn.1 Plus Health mobile app, which has also a number of vital healthcare resource tools. So let's begin. I want to acknowledge out there Barbara and Jimmy and Alan. Welcome to Pharmative Live. We've had some technical difficulties this morning with the internet, but we're up, streaming live, hopefully. And now we're going to talk about at-home COVID-19 rapid antigen tests. I think before we begin the topic, the very first thing I want to say to all of you, if you have not get vaccinated and you're eligible to get vaccinated in the United States, get vaccinated. And if you're eligible, according to CDC guidelines, which you can obtain at cdc.gov, if you're eligible for a booster, get your booster shot. This is the most safe and effective way that we have right now to prevent you from getting severe COVID-19 disease, from dying of COVID-19 disease or being hospitalized. Get vaccinated. The scientific data that we have now is overwhelming, both in the clinical trial setting as well as in the real world evidence of the COVID-19 vaccines. They're actually miraculous in their ability to prevent you from having severe disease. So get vaccinated, get your booster shots, and if you have questions, ask your doctors or pharmacists about the vaccines that are available in your neighborhood. Secondly, there's a number of things to think about when purchasing a COVID-19 rapid antigen test over the counter, and I'm going to go through with some of those matters for your consideration. First of all, what are some of the reasons why you would want to take an at-home COVID-19 disease? Well, first of all, you suspect that you have symptoms of fever, congestion, difficulty in breathing, and there are other symptoms as well. Now remember, if you're vaccinated, your symptoms may be blunted, right? So it may be an annoying amount of congestion that's persistent with a fever. You certainly want to make sure you're not contagious, so you want to get an at-home COVID-19 test. Or there are many clinics also around the country that are open to COVID-19 testing as well. So we have many options available in the United States. Hi, Diane. Please feel free to text your questions and your comments. We started a little bit late due to technical difficulties, but we're up and running now. We're talking about at-home rapid antigen testing for COVID-19 disease. Okay, again, get vaccinated, get your booster shots. If you're eligible for, you can check out those guidelines at cdc.gov. So the first and foremost reason someone might want to do an at-home test is that they suspect they have the disease. Now, whether you've had COVID-19 disease in your past and you have natural immunity wears off, okay? So you can get COVID-19 again. Whether you get vaccinated or not, The vaccines only last a certain length of time, somewhere between 6 to 9 months. So you want to make sure that you get your fully immunized, which with Moderna and Pfizer, that's 3 shots. And with the J&J vaccine, that's 2 shots. The original J&J shots, and then the second booster shot, okay? Even if you're vaccinated, unfortunately, with the variants that we have out there, you can still contract the disease. However, by far, if you are vaccinated, fully vaccinated with Moderna and Pfizer with 3 shots, J&J with 2 shots, the chances of you getting severe disease or hospitalized or even a life-threatening condition that can end up in death is much, much less than the people that are unvaccinated. So right now we're seeing spikes in the number of COVID-19 cases throughout the country, and that's largely due to the Delta variant. Omicron is out there, is highly contagious. The researchers, the scientists, the public health officials are gathering data to understand more about Omicron. But by far, the variant to worry most about is the Delta variant. And I know we're all getting a little COVID-19 fatigue. But the bottom line is, with health and illness, it's vigilance and knowing what you should and shouldn't do to minimize your risk, not only for yourself, but for your loved ones as well. Okay, so that starts off with first, get vaccinated and get your news on COVID-19 from reliable news sources that tell the facts. Okay, and I'm going to be so bold and brazen and name them. Papers, from big cities like Chicago, New York, Washington, D.C., and so forth. Local newspapers, public state health officials, the CDC, the National Institutes of Health. We have all these incredibly gifted, hardworking subject experts that specialize in infectious disease and combating viruses. You want to listen to the experts and not some hack on Fox News or on Newsmax or One America Network. Those networks, those last 3 that I told you, Fox, OAN, Newsmax, have consistently reported misinformation regarding the COVID-19 disease. Don't listen to them regarding your health and healthcare for you and your loved ones. Get vaccinated, listen to the subject experts and the public health officials out there with regards to the pandemic in your town or city. Okay, so the first reason that you might want to consider an at-home COVID-19 rapid antigen test is you suspect you have the disease, okay? You have an at-home test kit, or someone delivered it to your home, or someone got it for you. Take the test, you follow the instructions very carefully, okay? Because there's a number of different manufacturers of tests. They generally revolve around taking a nasal swab, using a solvent, and then placing the swab into a test tube, which will eventually give you the result. But they're all slightly different, so you have to follow the instructions very carefully, especially the first time you're using any new test device or taking any new medication. You want to read the instructions very carefully. Okay. There's a number of other reasons why you would want to get an at-home COVID-19 test. Number 2, you're planning on traveling. You're planning on traveling overseas for the holidays, okay? So what you need to do is check what the requirements are for testing internationally at your airport and then the airport of your destination. Oftentimes, this is going to require a negative test result within 24 hours of boarding the plane. Now, the good news is many airports, many hotels, many business centers surrounding travel will have availability of rapid antigen testing, which is good news. The question is, which test do you use, right? Following the instructions, and don't leave it to the last day before you're leaving on your trip. plan ahead of time because there may be limited supplies of at-home test kits, okay? The other reason that you may need a test is that you're attending a large indoor event, or your business or your traveling requires some routine screening that you are indeed negative. So those are the main reasons why you would consider an at-home screening test for the antigen of COVID-19. I want to also remind you that your symptoms may be blunted. Okay, the Delta variant is out there. It's highly contagious. So again, when in doubt, get the test. Okay, if you do have a positive test, you want to immediately self-quarantine and monitor your symptoms. And then you want to contact the people that you've been in contact with. That's contact tracing. So in other words, if you test out that you're positive, you can be asymptomatic and be positive. You can be symptomatic and be positive as well. You want to contact those people that you've been immediately contact with to let them know that you had a positive COVID-19 test. And then you're going to monitor for your signs and symptoms. If your symptoms worsen, fever, take Tylenol for the fever. Monitor your symptoms for shortness of breath. And you can purchase either in your pharmacy or online a pulse oximeter, which is a very inexpensive device you clip on your finger, and it gives you an accurate measurement of the oxygen level in your blood. It should be 95 or higher. If it drops below 90, that means you really need to call your doctor and get some advisement on how best to manage your COVID-19 disease. There are treatments available. I'm referring primarily to as patients' symptoms progress, whether you're a candidate for monoclonal antibodies, which are available for national emergency use, which can help crush the COVID-19 disease. And soon, hopefully, there will be approved for national emergency use oral therapies that you take over 5 days that can crush the COVID-19 disease before it progresses. So there's a number of things that we can do regarding whether or not your test is positive. You want to be calm, cool, collected, and follow, again, the instructions not only on the test, but also common sense. And again, you want to self-quarantine if your test is positive. Okay. Now, one thing that I want to make you aware of, there are a number of products that are available for at-home COVID-19 testing. You want to look on the package for the wording FDA approval or FDA compliant for national emergency use. And the reason why you're looking for the words initials FDA, Food and Drug Administration, is that ensures a certain level of quality of the testing. Nobody wants to take a bad test and get bad test results. So you want to look that it's FDA approval / certified as a test for COVID-19 antigen at-home testing. That's number one. Number two, you want to look at the expiration date. Okay, many of these tests have a short window of expiration. Okay, so if you're in a pharmacy, those tests, by the way, may be kept behind the counter, and certainly gives you the opportunity to ask the pharmacist about all the different tests that are available. They can range anywhere from $10 to as high as $40, and they may include 1, 2, or more tests in a kit. But the question that you need to ask is, how many people need to take the test? Don't buy a surplus of test home kits because there are expiration dates associated with it, and some of them are short term. The other tip that I would like to bring to your attention, that if you're purchasing at-home tests online, you want to certainly look at the delivery date. The delivery date may be too long for you to wait to purchase your at-home test online. So I highly recommend asking, if you think you have the disease, asking a loved one or a friend to go out and purchase a test kit that's FDA approved at your nearest pharmacy or store. Instead of purchasing it online where you're not sure when the test is going to arrive. Obviously, there's a window where you need to take the test and you need to determine whether you're negative or positive to make the appropriate decisions moving forward. So again, check the expiration date. Now, also on the package should be what the sensitivity of the test is and what the specificity of the test is. And with any diagnostic test, there's always those two measurements. The sensitivity, which should be at least 95% or higher, and a lot of the tests out there are 97% or 98% sensitive, which means that if your test is positive and your sensitivity is 98%, then 98% of the time, a positive test means you truly have the COVID-19 antigen test, okay, to be positive. 98% chance that it is a true positive. Specificity is the other term that should be on the box. And again, we're looking for it to be over 95% and hopefully 97 or 98%. And when your test comes back negative, it means if your specificity is 98%, 90% chance that that test is truly negative and you do not have the COVID-19 disease. Sensitivity and specificity, those two should be approximately over 95%, 97, 98%. Some of the higher quality tests do achieve, and I would say go for a little bit more of an expensive test with a higher sensitivity and specificity, and check that expiration date to make sure that you're purchasing a quality test. Okay. Now, finally, another major point is when traveling overseas, sometimes that you are going to require a telehealth representative on the phone with you to watch you go through taking the test and then verifying that indeed your name on the test is truly negative. And then they send you a verification, generally via emails, possibly it could be through text messages, to verify that you have a negative test result before traveling. So check to see if your home health kit test that you're thinking of purchasing provides a telehealth service that will help you or assist you in taking the test, but verify that your test results are indeed truly negative, and they will send you a verification of that. And a service that I found online, looking at my notes now, I want to say I'm not easily finding it right now, but on the package, it will definitely tell you what the telehealth service is. And oftentimes it'll ask you to even scan the QR code that will give you a web link directly to the telehealth service that they're working with on that particular COVID-19 test. So I think that's kind of a nuance that a lot of people are not that familiar with. I personally have not gone through that level of testing where I use a telehealth counselor, but that indeed may be required when you're traveling overseas. So purchase a test that has a high sensitivity and specificity for COVID-19 antigen. Make sure it's not an expired test. When you have questions, talk to your pharmacy technicians. Sometimes the tests are kept behind the counter, okay? Be a little leery about ordering online because the test result may not arrive at your home in time enough for what you need the test for, okay? And I'll leave you with one last final thought. Read the directions very closely. These tests are actually very simple to use and will help you make informed decisions with whether your test is a positive test result or a negative test result. Now remember, you are taking that test at a snapshot in time. Okay, so a negative test would say that at that particular day and time, person John Doe is negative, or John Doe was positive at that date and at that time. Okay, that doesn't mean that down the road, if you're exposed to the virus and you go through a period of time, and that you could turn positive down the road if you're exposed to the virus. Remember, both the Delta variant and the Omicron variant are highly contagious. So during the pandemic, we still want to continue to wear masks. We still want to practice social distancing. We still want to hand wash as much as possible. And if you're not able to wash your hands, use hand sanitizer. And you want to minimize your exposure to COVID-19 disease. I know that's easier said than done. But again, this is a life-threatening illness. And in the United States, we're approaching 180,000 deaths due to COVID-19 disease over the past couple of years. And with that, we're seeing increasing spikes in cases of COVID-19 disease throughout the country with the Delta variant, and we're monitoring very closely the Omicron variant as well. Okay, so that's it for today. That's what I'd like to relay to you about at-home health test kits. If you have further questions, contact your local doctor or your pharmacist or healthcare professional that can guide you through the appropriate measures in taking an accurate at-home rapid antigen test. Until next time, stay healthy.